My name is Souder, and I am a behavioral health therapist here at Stewart Memorial Hospital and Clinic. I have been practicing for about 10 years, and I see patients of all ages, anywhere my youngest patient has been 2 and my oldest patient has been 98. Some of my interest areas in treatment are trauma-based therapy, helping people work through past hurts or pains that have happened in their life and seeking health and recovery and wellness from those experiences, walking through grief. Recently, I've gained extra training and certification in perinatal mental health counseling, and then I've also had quite a bit of experience in working with kids and adolescents as well, especially in my period in working with the school system and providing in school therapy and services as well. I'm originally from the rural area. Before I went into mental health care, I was a youth pastor for a local church, and while I was working with children and families, I realized how much of a need there was for mental health care in the rural setting. I had kids that we were trying to get services for when they were in life-threatening situations, and we called around, and the wait period was 3 to 6 months for emergency types of situations, which was not okay. We just didn't have the resources, so that prompted me to go back to school because I saw a need for services where there was a massive gap. And I definitely have a passion for my local community in the rural area of the Midwest, and so got my training and then came back, and I'm excited to serve in our area and meet a need that there is a shortage for. Play therapy and child and adolescent-based therapy are very specialized types of therapies and something I'm very passionate about. Some experience that really helps to foster into that as I worked into the school systems for about 4 years. I feel like I have a lot of knowledge and expertise in understanding the school systems and the unique dynamics that are part of that experience for a child and the challenges. Especially in the rural education area, there's a lot of dynamics and challenges that are going on in our current school districts, and the experiences that teachers are going through, administration, and then the children and families. And so I'm passionate about working through situations like these with kids and families to help them find success, to help them even collaborate and advocate better in the school setting, and helping the schools work alongside with those kids and teenagers as well, and the families, so we all can work together for the goals that we have for our communities, for our families, and especially for our kids. So I have some specialized training. I've done a lot of different trainings in trauma-based interventions. One of those is EMDR. I also do play therapy and some specialized different forms of play therapy, including TheraPlay and a specialized type of therapy that emphasizes children who have been impacted by substance use in utero and working with family systems. And then also some faith-based background as well for those patients who are seeking to have that in their treatment. I have my certification in perinatal mental health therapy that I received through Postpartum Support International. This certification involves getting specialized training through PSI, which involves several days of intensive trainings overviewing all the different factors that are a part of the perinatal period, which includes that time during pregnancy and also the 2 years post-pregnancy or pregnancy loss. So I'm working with patients, not just women or those who are carrying baby, but also the families that support and empower them in that role as well. As a therapist, I get to journey with people in the most vulnerable areas of the life that maybe no one else knows about. And so I get to celebrate some very unique milestones and growth. And that is so fun to be able to do, to see someone be able to sift through the areas of their life that are a challenge or that are scary or just messy, and see them be able to develop new confidence, new empowerment, new health, healing, and wellness. To see them be able to do that is so exciting. When we've gone through situations in our life that we would classify as trauma, which is essentially experiences that go beyond our ability to cope. So there's a lot of things that can fall into that category. And sometimes I describe therapy as this experiences of like going to the trash can and changing the liner. A lot of times you want to go in and change the liner and just not pay attention to the stuff that sits at the bottom of the trash can. But a lot of times in therapy, we are going in, we're taking out the liner, we're looking at that stuff, and we're starting to make it fresh, make it clean, make it new. And And that is a process, but one of the things I encourage you as a provider and as a therapist is that I'm going to meet you in that we're going to journey with you. We're going to make that easier. We alongside you and we empowered you to get through that and to take control over those experiences that you felt had control over you or continue to have control over you. We want to join you in that journey and help you not have to go through or feel like you're having to go through that alone, or that it has to be something that is going to negatively impact you for the rest of your life. When you do call into Stewart Memorial and to inquire about services and getting set up with a provider, one thing that I love about our department is we help you identify what are your immediate needs and who's going to be the best provider for what you're going through. We want to meet you where you're at. One of the factors that they've identified in effective therapy consistently and over again is the therapeutic relationship with your provider. And so we want you to have a good therapeutic relationship with the provider that you're engaging in services with. If you're struggling, I encourage you to reach out to any of the resources that are available to you in your area. For here in our area, you can reach out to Stewart Memorial by phone, or you can hop on our website. Check out all of our providers and services that we provide to meet the needs of people experiencing behavioral health or mental health challenges.
Choose excellence, choose Stewart Memorial.